We had a first hearing where we had members from Colorado and National Conference of State Legislators come in and give us a lay of the land of what's happening in all the states around regulating marijuana. We had a second hearing on economic development, the next one on law enforcement, and this final one now on public health. It's certainly my goal. I think there's lots to be learned about this. I think cannabis legalization has been moving forward, and it's my belief that we need to get in front of it and do this in the way that works best as possible for Illinois and really be in front of this.
Our next panel of proponents includes Dr. David Nathan, Dr. Leslie Mendoza Temple, Molly Lotz, Reverend Alexander Sharp, Carmen Brace. Those are the 5 names that I have. In the same manner that we attempted to try to limit the overall testimony to 5 minutes, amongst 3 to 5 minutes from the entire panel. Oh, for each person, I'm sorry. For each person, let's attempt to try to follow suit with proponents as well, so that we can leave more time for questions from the members. Next, if you could identify yourself and then just go ahead.
Good morning. My name is Carmen Brace. I am the founder of Aclara Research. We are a group of consultants focused on cannabis and patient consumer insights across legal markets in the United States. Today, I will begin by giving you some information on some of the self-funded studies that we have conducted across the nation. 2 years ago, I began qualitative research with cannabis patients in Michigan to understand the experience as a cannabis patient within the healthcare and legal system. I partnered with a cannabis testing company, ACT Laboratories, and co-led patient support groups for a year. Listening to patients discuss their conditions, reasons for usage, and societal and legal experience helped me to understand their difficult journey through the healthcare system. Across many different conditions, cannabis usage was driven by very common symptoms, such as trouble sleeping, joint pain, and anxiety. These insights led me to develop quantitative studies of patients in Michigan and the first studies of the Illinois cannabis patient population in 2017, the Illinois Patient Experience Study in January, and the Medical Cannabis Impact to Prescription Drugs Usage Study in September. The first study, a 71-question survey fielded in partnership with the Illinois medical cannabis community, quantified not only the leading symptoms and drivers of cannabis usage, but also qualifying conditions, usage history, incidence of chronic pain, product efficacy, and the experience within the dispensary. Insight number 1, reasons for cannabis usage impact over 130 million Americans. Across the 41 specific medical conditions required to access cannabis in Illinois, there are very common symptoms which drive the cannabis usage occasion. Trouble sleeping, anxiety, body ache, joint pain, and back pain are the leading symptoms across respondents. If you take a look at the chart within my testimony, you'll see the percentage of patients that use cannabis to treat these five symptoms and the number of Americans that are impacted by these 5 as documented by these sources. Now, these symptoms, for which incidence is quantified by the U.S. Center for Disease Control, the National Institute of Mental Health, the Department of Health and Human Services, and the American Academy of Pain Medicine, impact over 130 million adults. A 2012 study within the Journal of Pain estimates the societal cost of chronic pain conditions to be $635 billion annually. This insight into the driving reasons for cannabis usage within the patient community illuminates the size of the state population that could benefit from using cannabis products to treat these symptoms if more widely available. A fair share of symptom incidence rates across the Illinois adult population of 9.8 million indicate that 5.4 million adults may be impacted by these common symptoms, but only 24,000 Illinois residents have access to legal cannabis in Illinois. Expanding adult use across cannabis products could improve healthcare outcomes for adults that regularly experience these symptoms and allow them to purchase the product in safe retail environments. Insight number 2. 33% of respondents stopped using all prescription drugs. The Illinois Medical Cannabis Program has enabled patients to stop or decrease usage of prescription drugs. Within the above study, 33% of respondents stopped using all prescription drugs after using cannabis. These results are consistent with our studies across markets in Michigan, Oregon, and Colorado. Insight number 3, 67% of respondents stopped using opioids after using medical cannabis. The U.S. Center for Disease Control reports that opioid abuse has resulted in over 200,000 deaths from 1999 to 2016. More than 46 people die every day from an opioid overdose. In 2016, almost 1,900 people died from an opioid overdose in Illinois. This epidemic prompted us to develop a 43-question survey in conjunction with 3 Illinois pharmacists active within the cannabis industry. Luba Andrist, RPH Vice President of Patient Care at MedMar Dispensaries of Illinois, Ann Berg, PharmD, Consultant Pharmacist, and Joseph Friedman, RPH and COO of the PDI Medical Dispensaries of Illinois, to understand patient engagement with pharmacist professionals and the impact of cannabis usage across prescription drugs, namely opioids. 67% of our respondents stopped using all opioids after using medical cannabis. Please refer to the chart within my testimony, which indicates the following. 87% of respondents used opioids before using medical cannabis. Again, 67% stopped using opioids, 29% decreased their usage, and 4% did not change. The leading opioids used by this cohort were as follows. Hydrocodone combo at 23%.
Ms. Brace, can you bring your testimony to a close, ma'am?
Yes.
Thank you.
Vicodin at 20%, followed by OxyContin and oxycodone, also known as Percocet. The CDC prescription opioid overdose data indicates that the most common drugs involved in prescription drug overdose deaths are methadone, oxycodone, and hydrocodone, 2 of the leading opioids previously used by Illinois patients before using cannabis. These studies are in concert with the 2016 Journal of Pain study indicating that 64% of patients also decreased opioid usage after using cannabis. The above retrospective studies indicate that chronic pain patients, estimated at 40% of U.S. adults, find cannabis to be effective in managing pain and other related symptoms. Expansion of legal access to cannabis in the state of Illinois to combat opioid abuse could be added as an 8th strategy to the current state of Illinois opioid action plan to combat this epidemic. Thank you for your time.
Thank you, ma'am.